Okay. Namaste, everyone. I'm Dr. Shubhada Kulkarni. I am a practicing MD homeopath from Usher Homeopathy Clinic, India. I welcome you all to the 8th anniversary of Global GHK. Today, my topic is how GHK has helped me in my practice, especially into hormonal disorders, especially into thyroid disorders. So, before starting with that, let's have a disclaimer that this information given in the presentation is for educational purpose only. It is not intended to be a substitute for professional medical service. Participants shall consult their medical doctors for health reasons before using anything that is disclosed during the course of this presentation. And students, importantly, shall not use any of the different information given in this presentation while writing their examinations. Thank you. So, first of all, I really want to express my deepest gratitude towards Dr. Samuel Hahnemann, who is father of homeopathy, for his visionary work that guides us even today, and Dr. Hammer, the father of German New Medicine. I thank him for his revolutionary insights. Also, a heartfelt thank you to my mentor, my guru, one and only Dr. Asher Sheikh sir, for his valuable guidance. And at the end, of course, the wonderful Team Asher Clinic, for I thank them all for their support too. Also, tons of thanks for GHK team. I'm truly honored to be part of this wonderful journey. So today I want to share how German New Medicine (GNM) and GHK has transformed my approach as a homeopath, particularly in hormonal cases like thyroid disorders. So think of your body as a beautiful orchestra. Every organ, every gland and cell is a musical instrument, is like a musical instrument, playing its part in harmony, where hormones acts as a conductor, keeping everything in sync. But when we face stress or conflicts, it's like a wrong note being played. It disrupts the entire rhythm. This is where GNM comes in. So it sees diseases not as random events, but as the body's response to specific emotional conflicts. So we have the example of thyroid problems. It is often linked to feeling slow, not getting the morsel they want, or unable to keep up with the life. It is like a mental traffic jam. So this is how we proceed. Let's further see about the thyroid gland. Thyroid gland possesses an enormous power where your body, just like an operation manager in any company, the work of thyroid gland is make sure that the cells of your body are working properly or not. So it is like, besides that, the thyroid gland has one more important task, which is the production of thyroid hormones, that is T3, T4, and calcitonin, as you all must be aware about. So here we need to understand this cycle of hormonal feedback. How does it takes place? So the brain, especially the hypothalamus and the pituitary gland, acts as the thyroid's boss. So they order the thyroid. So hypothalamus sends a signal called as thyrotropin releasing hormone (TRH) to the pituitary gland. The pituitary then releases TSH, thyroid stimulating hormone, to the which tells the thyroid gland, which tells thyroid gland to get to the work. So the thyroid gland uses the external iodine from food that we eat, like salt, seafood, and dairy products. So as the raw material to make it to make those thyroid hormones, that is at the left corner, you must be seeing T3, T4, and calcitonin. So these three structures communicate and work together. And that is where we called it as hypothalamo-pituitary thyroid axis. So Thyroid produces the two main hormones, that is T3 and T4. T3 is the active form directly used by the body, and T4 is in the storage form which gets converted into T3 whenever needed. So thyroid works in this feedback loop. So there is, if in this feedback loop, when there is enough T3, T4 in the blood, the brain tells the thyroid to slow down the production. And if the levels are low, then the brain signals to the thyroid to produce more. So T3 and T4 are inversely proportional to TSH. So this seems simple. So this simple mechanism keeps up your body in balance. If anything disrupts, like the disrupt note we have learned before. So if anything is disrupt, it can lead to thyroid disorders. So it is hypothyroidism, where the thyroid function is low, and hyperthyroidism, where thyroid functions where thyroid is overactive. So let us understand what GNM has to say. Honestly, thyroid cases used to be some of the most challenging for me. Like, patient used to come with symptoms like fatigue, weight changes, mood swings, and expecting quick results. While homeopathy would bring the relief, of course, why not? But the symptoms often relapses even after giving the exact similimum. So it felt like I was treating the same case over and over again without addressing the root cause of the disease. So, what is the root cause of the disease then? Here, GNM helped me like a miracle. So, we'll understand one by one. So make to make it more simplified, GNM has divided the thyroid system into three parts: the thyroid gland, thyroid ducts, and parathyroid gland. So each of these areas is affected because of the different biological conflicts. So the thyroid gland, first we'll see thyroid gland. About the thyroid gland is situated in front of your lower neck, below the larynx, with one lobe on each side of the trachea, left and right. Originally, the thyroid gland was located in the oropharynx. Interestingly, you must be aware about it, but there is something new here, that it was descended to its final position, taking a path through the tongue and the neck. So this connection, now it is known as thyroglossal duct. So this is the part of endodermal thyroid. Of course, it is part of endodermal origin, and it is controlled by the brainstem part of the brain. So primary function of thyroid is production of thyroxine. But it is interesting to know that initially, thyroid gland was an exocrine gland. So it used to excrete the hormones into ingoing and outgoing section of intestine to facilitate the ingestion of food and elimination of the feces. Ingestion of food and elimination of the feces. So after the gullet had broken, it was before exocrine gland. But after the gullet had broken during the here comes the embryology part. We need to go deep into that. We'll of course have more lectures on this. But for now, let's understand overall. Thyroid become an endocrine gland then by releasing thyroxine directly into the bloodstream. So the thyroid gland consists of intestinal cylindrical epithelium, which originates from the endoderm and is therefore controlled by the brainstem. So that's why thyroid has the same origin as of the alimentary canal. As the lining is same, the endodermal layer is same, the brain control part is same. So conflict might be same. Let's see how. So of course it is the part, it is derived from endoderm, the oldest biological layer, the organs controlled by brainstem. Brainstem again the oldest oldest part of the brain. and that is brainstem, and it is linked to some survival conflicts like death, fright conflict, morsel conflict, starvation conflict, etc. And of course, it reacts with cell proliferation. So during healing, the oldest bacteria comes up to enhance the healing. Again, oldest bacteria. Which was the oldest bacteria? Tubercular bacteria. So this is a list of other organs controlled by the same origin and same brain part. Okay. So of course, as I said, same origin, uh, controlled by the same part of brain. So here comes the conflict. So the conflicts are also similar. That is Morsel conflict. So you must be aware about what is Morsel conflict. Uh, we can say there is only one conflict. Most of them is Morsel. Morsel conflict is there, but it varies according to the location. If it's mouth and pharynx, so it's like not being able to catch or eliminate a morsel. If it's thyroid gland, then not being able to fast enough to catch or eliminate a morsel, because first, mouth is all about gulping, all about catching something, eating a morsel, having a morsel. So it's about not being able to catch a morsel. Then not being able to fast enough. For thyroid, thyroid gland is related to your speed. Because of thyroid hormones, you get into speed, you become slow if the thyroid function is low. If it is overactive, then you become fast, you get palpitations. And of course, it is related to your resting phase, your parasympathetic sympathetic phase. So it is the morsel is related to not being fast enough to catch that morsel, or of course eliminate the morsel. If it's esophagus, then it's not being able to swallow a morsel. So according to the function of that organ, the morsel varies. Not being for pancreas, stomach, duodenum, small intestine, and colon, etc. It absorbs the food morsel, right? So the function is absorption. So the conflict will be not being able to absorb or digest the morsel. So it is there is a concept that it is widespread actually. He believe that hypothyroidism is caused by iodine deficiency. This theory is true, no doubt, but however, it cannot explain that why only left side of the thyroid gland is affected or the right side of the thyroid gland is affected. So, if you see, right half of the gland is controlled by right side of the brainstem, whereas left half of the gland is controlled by the left side of the brainstem. So there is no crossover correlation from brain to organ. So no left and right laterality. However, as alimentary canal has two openings, thyroid gland we are relating it to with alimentary canal. So it has two openings, mouth and anus. So one is ingoing and another is outgoing section. Same for the thyroid. It is considered that right side is ingoing section and left side is outgoing section. So this is how side-wise conflict varies a little. If we see right lobe of the thyroid gland, it is called as ingoing morsel, that is not being able to fast enough to catch a morsel, and left side it is outgoing morsel that is not being able to fast enough to eliminate a morsel. Here we can see an example for ingoing a job, a position or a promotion or a contract, that I'm not fast enough to get that contract. Or here we can say I'm too slow. I'm too slow to get rid of that thing. I'm too slow to get rid of that partner, or I'm too slow to get rid of that lecture series or something. So the thyroid symbolically represents body's peripheral circadian clock. So we have learned that thyroid represents as circadian clock. It is always related to the situation, related to time. Hence, the conflict is more related towards time. Like, if we can see more example for this, patient may say, "I cannot get or catch it. I am too slow. I want time to stop. I'm not fast enough to achieve such a thing. When will my turn come? When will my time come? I want to get rid of this, but I cannot. I lack in confidence." These all type of emotions comes under thyroid morsel conflict. Here we have an example. An older employee feels that he can no longer keep up with the young people in the company. He cannot hold to the strict time discipline. The firm's management would rather have a younger, more dynamic man in his position. They want him to retire. Soon afterwards, he is diagnosed with thyroid cancer. So, here, not being able to hold on to his job because he is too slow can be his morsel conflict. Another example, sorry, another example we have here is somebody has inspected a house that is for sale. A loan must be worked out with the bank. In meantime, a cash buyer snaps up in the house that is not getting the house because of being too slow. That can be a morsel, ingoing morsel conflict. So simply stated, conflict that one is too slow, putting oneself under pressure to be faster or being put under pressure. Too little time for too many things. So this chart is really important. Let's understand the mechanism. So what does this conflict does to us? So whenever conflict or stress occurs, the hypothalamus secretes corticotropin releasing hormone, CRH, which releases adrenocorticotropic hormone, that is ACTH. Adrenocorticotropic will stimulate the adrenal gland, which releases the hormone called cortisol. Cortisol is a stress hormone, which acts for uh, fright and flight mechanism, like fear and flight mechanism. So cortisol can inhibit the secretion of TSH, that is thyroid stimulating hormone, from the pituitary gland and leading to partial suppression of thyroxine. Hence, we'll end up into hypothyroidism. This chart is something that explains further. This chart is something that explains you this mechanism in all the phases, like conflict activity, then healing, and when this never ends, you go into hanging healing. So let's understand this in detail. For conflict active phase, so during this phase, the thyroid gland cell proliferates proportionally to the intensity of conflict. The sole biological purpose here is being to increase the secretion of thyroxine. Why? So that the individual becomes more faster to catch the desired morsel, to get rid of the undesired morsel. And what happens in healing phase is the following the conflict resolution. If the conflict is resolved already, then the fungi and bacteria, the oldest bacteria, as we have seen, removes the cell that are no longer needed. So here we will get the symptoms like pain, swelling, difficulty to swallow or breathe. That the symptoms of thyroiditis, right? Thyroiditis is the inflammation of thyroid gland. So thyroiditis will come under which phase? Healing phase. With the completion of healing phase, the thyroxine levels return to normal. But if it doesn't return to normal, then it goes into hanging healing phase. You can see the zigzag line. You never come to normotonia. With the hanging healing, when the healings are repeatedly interrupted by conflict relapses, the prolonged decomposing process results into loss of tissue, thyroid gland tissue that leads to hypothyroidism or Hashimoto's disease. So every time you will observe that patient when comes with hypothyroidism, there must be cell proliferation, right? So he must be having history of hyperthyroidism first, and then he will end up into hypothyroidism. So this is something new I got to know from this GHK. So what we have to do from all these thing is to maintain this balance to stay at normotonia for the better healing. Just to summarize, how did it help to me? So what questions has to be posted to thyroid patient so you can reach to the destination, that is similimum. In our cases as a homeopath, we come to a similimum a medicine to give that patient, which will eliminate the symptoms from its root. So what's the root? Here we get the root cause with the help of GNM. So what questions would you ask? So what are the time bound works that you are doing? So do you feel yourself slow? Do you feel yourself fast? Do you compare yourself with others? If 15-year-old, 16-year-old teenagers come to will ask you, how's your relations with sibling? How do you compare yourself with your friends? Where do you find yourself helpless or powerless? Why powerless? So this is the conflict for thyroglossal duct disorders. So it is a different, another topic overall. We may learn it afterwards. For now, let's learn from a case. A 15-year-old male patient came with the complaints of hypothyroidism since 10 years. He was having symptoms like stunted height, throat pain, recurrent throat pain, swelling over face, recurrent cramps, and trembling of muscles. And these four were the medicines he was taking. So when we took his history, his nature history, he told us that my father is extremely strict and he always punishes me harsh. If I disobey him, he will punish me severely. I'm really afraid of him. So I listen to him and go to school, tuition, then playground, and then tuition again. I don't enjoy going to those classes, but I have to. I want to be a cricket player. I like to play, but he makes me study only. He wants me to balance studies and cricket, but I only want cricket because studying is tedious and takes up all my time. So when would I then have free time to play cricket? I feel anger towards him. Sometimes I express and then I go outside. He gets angry very easily, will throw things in anger. He may harm himself or other. So it was not that polite as it sounds. So we asked his mother about him. So she told me that generally is a good child who cleans up his room when he's not angry. But when he is, then he acts out of control. He had asthma since third standard. That time he had a fall on head. I remember that he was very scared. So here we got the death fright conflict for lungs. For asthma, we asked where have been scared of, like it was fear of death level fear. I want what I mean is we can ask the patients with lung pathology, with asthma, with pneumonia, with bronchitis. We ask them about their fears. So she openly told me about his careful incidents that he had fallen head and he was very much scared, and that time only he had asthmatic complaints. He's too stubborn too. He has fear towards his father. At times he used to hide himself from his father. So after committing any mistake, but now he answers back him too. So any complaint from school, I asked about his school thing. Then school teacher says that he is very abrupt sometimes. So his father was also there. We confirmed from him too. So he told us that he's extremely stubborn, doesn't listen, and dislikes studies. One day, when I was about to slap him for his misdeed, he stood up and said, "Hit me, do whatever you want to do." So previously, he used to get anxious before going to school, stating that students tease me because of my behavior. So only within the family he shows his furry. Otherwise, he is quiet, reserved, innocent, and shy. So he cannot accomplish many things at once like other children do. So his father was only comparing him with other children. He also added that I think because he is extremely slow in speed. So here we got his morsel. His morsel was playground. So he was unable to manage or too slow to manage everything like tuition, school, classes. And because of father's domination and fear of punishment, he has to attend tuitions more, though he wants to play cricket and become a cricketer. So for him, the morsel was playground. So, what makes GNM so amazing is how it works hand in hand with homeopathy. So, homeopathy treats the whole person, body, mind, and emotions, everything. While GNM helps to identify the root cause quickly and precisely. So, it's like having a map and a compass. So, you will find the about way for the healing. So, on the basis of all these, we have given him the homeopathic medicine called as anacardium. And here, the results. First is the TSH level was 6.4404. Then, uh, thyroid medicine also tapering down, right? Here, two medicines were giving, and then they tapered it down to just one tablet with 62.5 uh, 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 power, and the TSH levels are 1.2825. Even after tapering down the allopathic medicine, the TSH levels were normal. Then they stopped the medicine. The thyrox medicine was going on. They stopped the allopathic medicines completely, and still the thyroid TSH levels are normal. In fact, below normal. So here he is going into hyperthyroidism, or he is healing now. So that is the study we have to do. We have these many cases where the morsel differs and just result just comes in front of you. In this case, uh, we have very less time to talk. There are so many cases. But now what we are here to understand is, you are familiar with the story of turtle and the rabbit. The turtle was discouraged, telling that you are too slow to win the race. But turtle was aware about the GNM conflicts and his psyche, brain, body reaction. If he hadn't, then would never have won the race. So this is just an analogy, but what we have to do is the most important thing is to find out the conflict, and if possible resolve them in real life, so that the hanging healing comes up to an end. When we become aware of this tendency, we have the choice to respond differently. If even after conflict resolution thyroid hormone production doesn't start, then we intervene with medicines, or with homeopathy you can go hand in hand. You can use these thoughts of affirmations too, like I'm fast enough, I don't need to be in haste, slow and steady wins the race. So affirmations are also important for patients too and for doctors too. So for every thyroid, PCOD, or adrenal imbalance case, I don't just ask why what are your symptoms, but I ask what was happening in your life when this began. GNM gives me the key to unlock the answers, and homeopathy provides the healing, of course. Together, they don't just restore health, but restore harmony. That is the thought of today. Wow. So thank you so much, everyone, for being so attentive. I want to extend my heartfelt gratitude to the leaders and the followers of GHK for giving me this wonderful opportunity to share my experiences and insights today. It is really an honor to be part of this revolutionary movement that's changing how we understand and approach towards health and healing. So thank you so much. For any kind of doubts, as a doctor, as a patient, or just as a person, please feel free to contact here are the details for Usher Homeopathy Clinic. Thank you. Thank you so much.